I went in with an open mind, an open heart, and I said, you know what? I'm willing to learn the truth about all of this because
Mhm.
I don't understand.
Yeah.
I know that it's hurt me. I know that it's hurt a lot of people, but I don't really know why. What's at the root of all of this? And if there is a way to make a change, how is it going to happen? So I went in with those questions. And
Yeah.
since then, so much has unfolded and so
Mhm.
much I believe has healed. I've had a lot of growth and healing through that and also witnessed that in other people.
Wow.
You are now tuned in.
You are now tuned in to Let's Talk About Healing on Hindsight Media Radio 103.5 FM. Now here's your host, Yvonne Pierre.
Hello and welcome to Let's Talk About Healing. On this podcast, I have interesting conversations with guests on various topics about healing the mind, body, and spirit. Today, we'll be talking about healing the healthcare system from within with Kian Xie, a business intelligence advisor who helps leaders on the forefront of innovation in the healthcare industry. He also works with holistic healers and communities to develop new ways to influence and change the mainstream healthcare. You know, there are many people who have such a negative, or should I say, cautious perception of the healthcare system. I've had many conversations myself about the system here in the United States. I have had to advocate for myself as a Black woman and my son with Down syndrome. But we'll talk about that later. Let's talk about healing the healthcare system. Ken, welcome to the show.
Thank you, Yvonne. It's great to be here.
Now, I do want to talk about the healthcare system and all the issues and your vision and all that. Before I get there, I want to know what inspired you to get into healthcare in general.
Yeah, so it's deeply personal to me. I think ever since I was a child, I
Mhm.
was aware that the US healthcare system had a lot of problems.
Yeah.
And I didn't think that much of it. I always kind of held it in my heart as something that I cared about among many other social issues. But the real pressure came when I was 20 years old
Hmm.
and I was dealing with MRSA, which is an antibiotic resistant staph infection.
Hmm.
And this kicked off a chain reaction of events where I started out thinking I'll just go to the doctor and everything will be okay. And
Right.
turned out it wasn't. And the infection became resistant to 5 different antibiotic drugs that I was put on.
Hmm.
And I went from doctor to doctor, specialist to specialist, couldn't figure out really where anything was going. From there was a point where it seemed like the infection was gone. They were culturing the wound. There was no infection left, but why was the wound still not healing?
Right.
And they told me that I had eczema, which is an autoimmune condition of the skin,
Hmm.
prescribed me some steroids, and they didn't work. So I got really confused. I felt really betrayed. I felt really heartbroken because I was putting trust in these doctors to know what was going on with my health and to help me. But it only felt like things were getting worse and worse. And over again, I felt like I was being dismissed and told that what I was dealing with wasn't even real and I just need to get out of their office.
Mm.
And through that process, I also was having financial trouble. I noticed that when I went to the doctor and asked for financial assistance to get my lab work done, the staff there weren't treating me very respectfully.
Yeah.
And I felt hurt. And there was some point after almost a year of dealing with this that I thought, nobody else is really going to take care of me. I'm going to have to take things into my own hands. I'm going to have to figure out some way to take responsibility for my own health and my own life.
Yeah.
And that's really, I think, when my whole journey around healing begun. And I didn't really know anything about health and healing, just some very basic information. But I started to read, I started to build community, I started to change habits in my life. I started to identify people, relationships, activities that were destructive and try to stop them, try to change them. And that was really hard. And as I moved forward, I discovered the holistic health community and all of the resources that they had to offer. A lot of it helped. I found some practitioners. I learned about healing modalities, and I actually trained to be a practitioner myself. I was certified to be a health coach. I went through herbalism training just so I could learn enough to help myself.
Yeah.
But I also felt that as I was improving in my health, and this was really a very slow process and very trying process, but I was improving over time, I realized I would really like to help other people too.
Mm.
And I think that's an experience that a lot of people have as they get involved in the holistic community. They join for themselves, they start seeking out healing services, new healing modalities for their own well-being, and then they realize I would really, really like to bring this to people in my life, my loved ones and my community.
Yeah.
So that's what I did, and I got more and more engaged. And I would say it was about a 10-year span of time that I was struggling with chronic illness in various forms, dealing with various autoimmune symptoms, the infection that kept reoccurring, and just overall struggling with the mental and emotional and spiritual side of the healing, which was realizing that I had had a lot of false beliefs, a lot of self-judgment, a lot of self-hate, a lot of emotional trauma that was all connected to my physical health.
Mm. Yeah.
So, yeah, over the years, I was able to learn more about that. But I developed a real chip on my shoulder when it came to the healthcare system because it had failed me.
Yeah.
And I vowed I will never work in healthcare. I will never support this system. But I got to a place where my financial struggles were continuing and things were just not working out for me. I thought that, I would make it as a self-employed business owner because that's what I had done before, but
Mm-hmm.
it wasn't working. I continued to struggle financially and I couldn't pay my bills. So I decided that I would get a corporate job. And again, I was holding on to this belief of I will never, ever, 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 ever work in the healthcare system.
Yeah.
Well, turns out the healthcare system, at least in my area, I live in New England, Massachusetts, the healthcare system is the number one employer of people. And if you're looking to get a job, especially someone with my background not really being engaged in the workforce for many years,
Yeah.
healthcare is really the place to go.
Hmm.
And that's where I ended up. And I had to challenge myself and say, I said that I would never do this, but could there be an opportunity for me? And the opportunity I found, I thought was really unique because it was on the business side of healthcare. It was working for a very large corporation and directly supporting the business leaders in that corporation as they underwent this big merger where they were acquiring a health insurance company and also expanding their business to provide more healthcare services. So this was an effort that affected millions of people across the nation. And I thought, I don't really feel good about what's going on here because if we're talking about the healthcare system and everything that's wrong with it, this is the ultimate corporate healthcare business. And I don't feel good about it, but look at this opportunity. It's so big. And maybe there will be a chance to try to make a change. And I went in with an open mind, an open heart, and I said, you know what? I'm willing to learn the truth about all of this because
Mm-hmm.
I don't understand.
Yeah.
I know that it's hurt me. I know that it's hurt a lot of people, but I don't really know why. What's at the root of all of this? And if there is a way to make a change, how is it going to happen? So I went in with those questions. And
Yeah.
since then, so much has unfolded and so
Mm-hmm.
much I believe has healed. I've had a lot of growth and healing through that and also witnessed that in other people.
Wow. Wow. I think it's interesting that there was an issue there. And because of your own experience, instead of you knocking the system like many of us do, I will admit that I have, you actually said, okay, how can I get in here and understand the issues that's going on? That I commend you for that.
Thank you. Well, I think my time in the holistic community taught me a lot about what happens when people turn away from the system.
Yeah.
Is what I see as a lot of holistic practitioners, they reject the system just as much as I did. And they said, let me build something completely outside. Let me develop new ways to take care of people, new ways to deliver healthcare to people that can actually help heal them. And
Yeah.
I do think that's admirable. But what I also saw was that it left a lot of people out.
Yeah.
It was financially inaccessible
Yeah.
to the people that needed it the most.
Yeah.
And to me, that just didn't feel complete. It just didn't feel right going into this and only serving people that had the money to pay for these kind of services out of pocket, which could get very expensive. Healthcare is expensive, and the only way that we're able to
Yeah.
afford it is through the insurance system.
Yeah. And insurance don't cover the alternative for the most part. It doesn't
Right.
cover the alternative. I have seen it. I had a friend that was battling cancer. She passed in February of last year, but I was somewhat her caregiver, and I was taking her to get treatments in Noonan, Georgia. And during that time, I noticed the way the whole system is set up at that center. And one of the things that they do have is alternative care. They have alternative options for the cancer patients. And I was impressed with that. But I was also concerned because I'm like, why does it take to get here for the insurance to cover that type of care? And,
Mm.
and instead of having that type of holistic care available, or where the insurance companies will back you with before you have cancer or you get to that point, because her insurance did cover it through the cancer center. And that was just mind blowing to me, that they part of their care is alternative medicine and the insurance companies support it. But it does need to be supported outside of there before you get to that point. To prevent, it should be a preventative and available to most people. So from you being on both sides, what are the misperceptions or misconceptions that people have about the healthcare system?
Well, I think one big misconception that people have is that people that are inside the healthcare system and work and lead within the system don't
Mhm.
care. They don't care about people. They only care about money. And, I will say that there's a lot of evidence for that. And it's not to say that there aren't those people in the system that are cut off from their hearts in some ways.
Mm.
But in the end, the people that work in the system, including the managers, the administrators, the business leaders, they're all human beings at the end of the day.
Yeah.
But they have different levels of perception of what's going on. And they have different levels of mental and emotional connection to the patient. And that's something that has been built up over time in a million tiny steps of our tendency to run away from pain, our tendency to want to turn off our hearts little by little. Because if everyone were to experience all of the pain of the people at once,
Mm.
something about that just feels dangerous. Something
Yeah.
about that. We can't hold that capacity. And so we as human beings have to work to increase our capacity to hold that pain and hold that compassion for others. And there have been a lot of forces in our system as a whole, not just talking about healthcare, but all of society, our global system,
Mhm.
that have run on foundations of trauma, violence, and oppression. And that's not so easy to fix. That's taking years and years. And some people say it will take another 10 or 12 generations to heal the kind of trauma that we've accumulated in our hearts and souls, in our
Mm,
bodies too.
mm, mhm.
So a lot of people go into healthcare wanting to help, and they still want to help, but they find that there are limitations, and some of those limitations are personal, and some of those limitations are structural. Where as a provider or as a frontline staff providing healthcare to patients, the demand is so big, there's a lot of people in need, and things get really, really busy, and you get so busy you don't have the time to stop and think.
Yeah.
And the managers and the administrators in the hospital, they likewise get so busy trying to figure out what's going on, and they're trying to manage the budget. They're trying to keep costs down, and their head is spinning. And the culture of healthcare has kind of been shifting because there's a phenomenon where healthcare leaders only talk to other leaders, and they don't want to engage with the frontline staff, and they definitely don't want to engage with the patients. And that really is a problem. But there are people entering healthcare leadership. And I think it's really interesting to see that healthcare of all industries has had the biggest growth for women in leadership. And I think that says something. I think there's still a long way to go
Yeah.
in terms of equity up and down the chain of command. But the fact that women are able to access leadership positions in healthcare
Yeah.
faster than in other industries means that there's at least some degree of openness to change, because culturally, women are put in the role of caregiver. So
Mhm. Mhm.
the change happens, but it happens, I think, when you look at it and you feel the urgency and the pain of everybody suffering at the hands of the system, and you want things to change. It feels like it's happening at a snail's pace, and it's just too slow. But at the same time, there is so much change happening every day in all these different ways. There's so much innovation that's happening really fast. There's so much of this, the past few years with the pandemic, we've been called to realize that people are human and start prioritizing mental health, start figuring out new ways that people can access care. And there are still a lot of really foundational problems. So I think that is what makes it really hard. But it's simply not true that people don't care about
Yeah.
other people. It's just that we're trying to solve a really hard problem that has been around forever.
Yeah. Yeah. I didn't think of it from that perspective, but I can imagine you do have to have some type of balance or a way to care, but not take it home with you. Every patient, every struggle, everything that you see. Because I can only imagine, especially the ones just dealing with the emergency room or just the general practitioner who may lose a patient. Just understanding from that perspective of there has to be some type of a balance between disconnect and caring. That really helped me to see, because a lot of times when we're sitting there waiting for the doctor to come in, we know that there's other patients, of course, but we want 100% of the doctor's attention to us when they come in that room. And that helped me to understand, even though I knew it, but to really look at it from the human side of the doctor's perspective. And not just the doctors, but the nurses and everyone else that help keep it running. And like you said, it's both. There's always bad seeds in every industry, but in every industry, there are people who care. So I thank you for pointing that out. And as an African American woman specifically, I usually say Black, but I'm gonna say African American woman because I can't speak for other cultures, but I know for me, because I've been in and out the hospital for some years, I have experienced where, my pain is not taken seriously. So these are perceptions that have been going on forever too, that Black women or African American women, we can handle it. Like I mentioned earlier, I've had to really advocate for myself, because if I go in and I say I'm having pain, it's not really taken seriously. So the healthcare system is being brought up to date on changing their approach. But my question is, do you think from that perspective that things have changed? And what is it going to look like to change that?
I think we still have a really long way to go.
Okay.
And I think that we can't see the change that we really want to see in healthcare until we address the bigger issues, like exactly what you're talking about. Structural white supremacy and anti-Blackness, where we have built this culture into our unconscious minds, very largely unconscious, where we allow ourselves to see white people and Black people in different ways.
Yeah.
We have history around that.
Yeah.
So we really do. And the evidence that that history still continues, you can look right at the workforce, because when you look at the lowest paid frontline staff, for example, the CNAs, they're mostly Black women.
Yeah. Yeah.
And they are the ones directly providing care. They are the ones that are in touch with the people who are suffering more than anyone else. And yet they're getting paid the least.
Yeah.
And then you still have the overrepresentation of white people in general in leadership, white men and white women. But you know how I said women are making their way into leadership?
Mm-hmm.
It's still mostly white women.
Yeah.
And that, there's so much evidence you can look at just in our society that we have only moved the needle a tiny bit when it comes to race.
Yeah.
And if we don't continue to work to heal that, we're going to be held up in healing anything, in improving anything. But I think on the plus side, there are a lot of initiatives in place. There are more grants and more organizations being put together to advance women and people of color in their careers, to give people more of a voice, who come from marginalized backgrounds. So again, I think it's the same phenomenon of, yes, there's change. It's nowhere near the change that we need to see, but it's happening, and we're in that process of continuous growth. We all need to step up and do our own growth.
Yeah. And ironically, a lot of the doctors that I have experienced that from, some of them were Black. Not every time, but it is a system that's in place, that an invisible system. Even with my son who has Down syndrome, I noticed some issues as far as when I take him, let's say he's having balance issues, or if he's having issues with his stomach, digestive issues, instead of looking at the core of the issue or investigating or running tests or doing everything they would if he didn't have Down syndrome, they often put a lot of stuff off on, oh, that's common with Down syndrome. But my thing is, okay, that's still not answering my question. What is it and how do we fix it? Just saying he has it because he has Down syndrome is not a solution for me. I'm not okay with that response. So it's been many a times that I've had to say, okay, I get that. And not to be defensive or, argumentative with the doctor, but to ask in a very nice way, but firm, okay, but can we run tests?
Right.
But can we, test to see exactly what this is? I get that, but can we look a little further and try to fix the problem instead of me just going home with some cream, you know,
Right.
then really run the test. I've had doctors too that for my son that has been judgmental toward people with special needs and having to correct that. But since he's 21 now, I'm not as offensive as I was in the beginning. Now I look at it as a teachable moment and I bring it to the doctor's attention of what they're doing, not just for my son, but for the other patients too. I'm assuming some of them just don't realize that they're making those judgments, you know, or me as a diabetic, oh, that's because you have diabetes. Okay, but okay, so how do we fix it? And what is it?
Yeah.
Yeah.
One thing that I found, you know, we talk a lot in the community about what can we as patients and families do to make things better. And taking that mindset of self-advocacy and taking real responsibility for your part in your own health, instead of just allowing things to happen, it makes such a huge difference. And I mean, I do think that most of the bias that goes on, it's completely unconscious, and it's also a product of being really, really busy.
Yeah.
It doesn't make it okay, but there's
Right.
an explanation for it. But one thing we can do as patients and also as families, caregivers, is to remember that in the system, if it's not documented, it didn't happen. So that
Mhm.
means that if you ask for a diagnostic, if you ask for lab work and the doctor says no, then the next thing you've got to ask, the next request you've got to make is, can you please write it in my chart that I requested this test and you denied it? You said no, it wasn't necessary.
Mhm. Yeah.
Often that alone will get them to change their mind. But if it doesn't, then you as a patient or the caregiver of a patient, you have the right to put additions into your file, into your health record, which means you can write a letter right once you get out of that appointment. Write down, this is what happened. I came in with these symptoms. I made these requests and the doctor said no. And this was how the conversation went. They gave a reason. Maybe they didn't give a reason.
Yeah.
Formalize the letter and give it to the practice, give it to the front desk and request that it gets put in your health record. Legally, you have the right to add your own documents to your health record. And the more of us step
Mm.
up and do that, we may or may not get the results we're looking for, but the more that we do that, the more visible we will become and the more pressure it will put on management to do something about it.
Mm. See, and it's stuff like that we just, and I'm not going to say we, I'll say me. It's stuff like that that I just didn't know. I didn't know that you can, you know, sometimes we go in there and we feel, now I'll speak up, but as far as taking it to that step, you know, asking them to put it in my chart or to add it. Now I know to do that with my son as far as school, but in this whole advocacy thing, I'm still a student to it and still learning. So that is really good information. So how can patients get information to know what their rights are? Is that something that's available or is that something we just going to have to form groups and learn?
I'll have to circle back with you on the best specific resources right now.
Okay.
I do know there are multiple patient advocacy groups that you can find online. There are people that break down the law for you, make it more accessible. There are multiple groups doing that right now.
Oh, okay.
Let's circle back and, I'll send you that information. Are you able to put that, make a note of that, on your website or where this gets
Yeah.
published?
Yeah. So I'll add that.
Yeah, I think that'll be better too. I can put together a whole list, more comprehensive list, because some of these groups are specialized to people that have specific health struggles, and some of
Mhm.
them are specialized for disabled people as well.
Okay.
So I think, I'm going to put together that resource list.
Okay.
Um, in the meantime, I'm available on LinkedIn. You can find me on LinkedIn, and Facebook, Kian Xie Official. Um, healingthesystem.com. Right now, I've got a resource there specifically for holistic practitioners who want to engage with mainstream healthcare leaders. But I'll be adding more resources to that website as well in the future.
Okay. So, speaking of traditional and alternative care, how is it possible to emerge the two? And what does that look like?
Well, I think just like, you know, what you shared about the cancer clinic, this
Mhm.
is already happening. And we also have a cancer clinic up here that's integrating holistic healthcare into what it does for its patients. But there's still a lot of change that needs to happen. You know, we see from time to time, we see organizations going into hospitals and giving Reiki. We see volunteer programs that are entirely devoted to giving holistic care to patients, but they're still volunteer programs largely. And when there is funding put towards it, there are still limitations to that funding. And we need to be able to prove that this actually helps people and that this
Yeah.
actually helps the healthcare facility. Specifically, does it help them save money? Does it maybe help the health insurance companies save money? And that's where I think we should be putting our focus as a holistic health community, is figuring out how we can measure, first of all, how can we measure the health outcomes of what we do?
Mm-hmm.
But then going beyond that and translating that to financial outcomes. And I think that there's a huge opportunity in health insurance with the rise of value-based care. There are health insurance companies that are trying to get it to work.
Yeah.
It hasn't been very successful in the past. But the principle here is prevention. Can we prevent somebody from having to go to the ER? Can we prevent somebody from having to go to the hospital? And if someone goes to the hospital, can we make their stay shorter and make sure they still come out okay? If we can answer those questions and start to dialogue around those questions, that's going to go in the direction that will make leaders pay attention.
Yeah. One of my primary care doctors, she was diagnosed with MS and her health was declining. She was doing now, mind you, she's a doctor, she was an internal or is an internal medicine doctor. But she was doing everything medically she was told to do, but her health was continuing to decline. And she sought alternative medicine and holistic care. And she did her own research, of course, on what herbs to take, what foods to eat, how to heal from the inside and not just feeding herself medicine. And she was able to reverse a lot of the issues that was happening to her. So she learned the hard way what alternative medicine can really do, you know. So now she incorporated into her practice, but I think it will take doctors like her to actually have, like, in her roundup, maybe some other doctors that believe in both, to come together and with people which like you, who really believe that this can really help the masses. And I can see it working, but there's the drawback that a lot of people have, people who are skeptical about the healthcare system, is that they put bandages on the issue and just send you about your way. And they don't really get to the root of the problem. I've experienced that myself. I've had to research and look for ways to increase my blood pressure, because my blood pressure was dropping at one time rapidly, like to 70 over 50, just from walking. And they were like, oh, increase your salt, drink more water. So I was like, I have to do something, because, it wasn't treated as an urgency. And I had passed out at one point because my blood pressure was dropping. But it took me to really, really dive in and get to the root of the problem in order to help myself from within. So this is one reason people are leaving the healthcare system and looking for alternative options. Do you think doctors and nurses recognize the perception that they are portraying?
I think some of them do. I think that a lot of the time it's a tough situation because you're caught in between like this desire to really help people get better, to get to the root of the problem whenever you can. You have that desire,
Mm-hmm.
but you also recognize that they're suffering right now and they need relief from their suffering. And we're trying to work with a system of limited resources to give them that relief. I think for the doctors and the professionals that are more aware, they're really feeling it in their hearts. And it's tough because it's like they wish that they could take more time with the patient to figure out what's really going on. But they feel constrained. They providers and staff feel really constrained by the system. I think for those who are showing up and really caring for their patients, they're all struggling with that need for more time, for a real relationship to be built and trust. So, and for the resources to be available, the insurance coverage to be available to really dig down and get to the root of the problem, because the tools are there. Even if you're just looking inside conventional medicine, there are
Yeah.
a lot of tools that are there that just aren't being used because of a lack of resources and a lack of time
Yeah.
and a lack of insurance coverage. So, and then meanwhile, that patient in front of you is suffering, and it's not going to be humane within that restrictive system to deny them the symptom management that is going to relieve them in the moment. But then it kind of feels disheartening because you're putting them back out into the world to continue running on that hamster wheel because they haven't gotten to the root of the problem. And they are going to have to take it into their own hands with whatever resources they have to try to figure that out. And then there are going to be people that fall through the cracks
Yeah.
because they don't have that.
Yeah.
So it's something to sit with because it's a real limitation on many different levels that we have.
Yeah. One of my doctors, um, great doctor, but he will not even have a conversation with me about herbs, whether it's tea or capsules or black seed oil or anything that is actually working, like sea moss and stuff like that, because I will research and see, okay, what is it that I need to take, and I will find different vitamins and supplements that will help with diabetes or help with heart issues and all that stuff, and actually see doctors online talking about these things. But like many doctors that I've had, you can't even they won't touch it. They will not touch the conversation. They don't want to deal with anything dealing with holistic care. And I've had, like, my son has a lot of skin issues, and I kept asking, well, is there something he's eating that's causing this? Or is there something, what about his digestive system? And, maybe we should focus on his gut health and that'll clear up his skin. Oh, that has nothing to do with it. And it's apparent that a lot of issues start from what we putting in our mouth and what
Yep.
we're eating. But it's having that conversation with a lot of doctors, which makes you question. I'm going to give an example. One of my doctors, asked him why we can't talk about, supplements that I should be taking or shouldn't be taking or whatever. And he said, because they're not FDA approved. And my thing was, but you're debating with me about taking a vaccine, what that wasn't FDA approved. Stuff like that makes you question. It feel like you in an arm tussle with
Yeah.
with the doctors, because it's like, but you're contradicting yourself because you're saying one thing, but on the other hand, and not to say that the doctor don't care, but it makes us think that they're working for the pharmaceutical companies and not for us. And it's not all of them. Let me reinstate that. It's not all of them, but I have experienced it where you really have to do your own research to heal. And like you said earlier, but the holistic care community, even though you want to, run to them, but it's really expensive, and getting the testing and everything is coming out of pocket, and it's more so for those of a certain income that can afford it. But the ones who really, really need it don't have the funding to afford it. So I'm looking forward to the day when these industries really get involved and really show that they care more about the patients than the business part. And I understand the business part. They have to be able to pay. They have to be able to, you know, just like any business, you have the staff, the doctors still got to get paid, So I understand that perspective of it. I really do. But a lot of times we feel like the business of it comes before us. But you really helped when you said that to really look at it from a human perspective, that they're also stuck between a rock and a hard place because this is their job. This is their career. And they can't they can't tell me, and I have to remember that too, that they can't tell me something that they haven't researched or studied that may have an adverse effect, and then they get sued, because they get sued a lot too. So they have to be cautious about having certain conversations about CMOS or stuff that, they don't know or whatever. But yeah, I'm gonna go down a rabbit hole talking about that. But
And we really could because there are
yeah,
so many layers to this.
yeah,
But I think that it's important to remember that the reasons that we imagine why people are acting a certain way,
hmm,
it's never just what we see on the surface. There's always something underneath it, and something underneath that, just like we've been talking about. And I think you hit on something with that in terms of safety and liability.
hmm,
That doctor wants to stay safe, and they want to keep their license and their livelihood. And they also are going to come in with personal bias, and some doctors more so than others. I mean, I've had the same exact reaction talking to a certain doctor about my diet and saying, "Hey, I noticed when I change my diet, this is helping me." And the doctor said, "No, that's not true. Diet has nothing to do with
yeah,
infection."
yeah,
And I didn't believe that because this was my personal experience. But
right,
the other aspects, I think we always have to tie it back to culture. We always have to tie it back to race and colonialism, because a lot of the bias that educated doctors who, have reputable careers in the system, and it doesn't matter what your race is, this is in terms of the role that you play, there is a bias that we have set up that certain types of medicine are more valid than others. And the ones that get discounted are called folk remedies, traditional remedies, witch doctor remedies, because they originate in cultures that were colonized and historically marginalized. And the more awareness we can bring to that, because this is an unconscious bias in the industry that needs to be first brought to the surface before we can start breaking it down.
yeah,
And then maybe people will some people will realize, oh, wow, I didn't realize that I had that bias. And maybe instead of just discounting what my patient has to say, I'm going to educate myself a little bit more.
yeah, yeah. And I have to also be mindful of my approach, because I might have upset them. Because when I told him, I said, "Look," I said, "my blood pressure was all over the place. This was happening, whatever." And when I took black seed oil and I took sea moss and, I took these things, it leveled out like instantly. And he didn't seem interested. I said, "You really need to," because I was at that point getting annoyed. And I said, "You really need to look into it so you can really help your patients." And he said, "No, I'm good." You know,
Mm.
he was annoyed. We were both annoyed. So, and I had to kind of pull myself back, like me challenging him is not going to fix the problem.
Mm.
And I tell other people all the time that it's not what you say, it's how you say it. And I had to check myself in that moment and realize I came to him wrong. He's going to be defensive because I'm questioning him as a professional, and I'm coming to him like I know everything and all, so I can imagine on his end of how he might have felt. And I just had to self correct and realize that in that moment, I was wrong about how I came at him.
I think that if I think so much of this comes back to, like, if only we had the time to sit with each other, because when we get annoyed, when we get defensive about something, there's always a deeper pain underneath that.
Yeah.
There's always layers. It's like that doctor might be thinking, well, this is making me question everything that I was taught in medical school and everything that I
Mm,
learned being in the industry. If you're right and I'm wrong, have I been betrayed? And what a deep injustice,
I get that.
But I mean, people won't go there if they don't want to go there, and that's why we get annoyed and defensive, because we're not in a place, in that moment where we have the time and space and emotional energy to go into that real connection, that real wisdom of knowing that there's something out there that can help us in our world that we don't know about. Even though we've been taught that there is certain authority on things,
Yeah.
and we find security in having that authority, in the form of doctors, our scientific system, medical schools, education, certifications. And I think that can sometimes breed a culture of thinking that we know it all and finding our security there as people.
Yeah. Yeah. Yeah.
So,
I can see that.
I mean, I think over time, we'll create more spaces for the conversation, just like you're creating now with me, Yvonne, you
Yeah.
know, where we can actually pause and take the time to not only give out information and speak information, but also feel our feelings about it.
Yeah.
I think that's where the openness can really come and we can find some solutions that will work.
Yeah. So let's shift gears for a brief second. And let's talk about diversity, equality, and inclusion, DEI, for a moment. Where is the healthcare system with DEI? And is it being implemented or is it still a challenge?
Mm. I'm definitely not going to speak for the whole US healthcare system, because I live in an area which, thankfully, our politicians don't believe that DEI is a waste of time.
Mm,
You know,
mhm.
the political climate in New England is, generally receptive to, at least trying to work on creating equity, bringing more diverse voices into the scene, supporting people, as, they might want to overcome some of those barriers for themselves. So, and it also, even then, it depends on the institution. Some institutions make it a priority and others don't. What I find is the ones that make it a priority, they do so because they value the human relationships in healthcare. And they're somewhat in touch with the fact that when you genuinely care about people, everything else will fall into place, including the financial outcomes,
Mm,
including the money. And they also know that we're dealing with a younger workforce. And when you deal with a workforce in certain hospitals that are research based, you have to interact with the academic community. And then there's a certain pressure there to get an interest in DEI and at least start having the conversation. Um, so, I mean, I think it's happening. I feel like sometimes it's two steps forward and one step back, especially with the political scene around it.
yeah.
Because when you have politicians that say that, we don't believe in DEI and we're going to defund it and deprioritize it, then you can't really expect much to happen if the money isn't there. But when an organization has expressed that it's valuable, and it can be for the wrong reasons too, it might not really be in touch with caring for people. It might just be because they want better employee retention from a certain demographic. But for whatever reasons people do it, if we have the funding and we have the energy and we have the space to have the conversations, it's great. But there's still so much more work to do, because it's one thing to say, okay, we're going to start initiatives. We're going to start, having quotas for who we bring into the workforce. We're going to have patient equity programs. We're going to track and measure, how patients of different races and different backgrounds and different social locations are being treated and what their outcomes are. And that's all great to have the information. But emotionally, we still have a long way to go.
Yeah.
We still need more time, more patience, more space, and more comfort within ourselves to have the really hard conversations and to not just check off the box, because DEI is often just a checkbox activity and people don't really think it's important. But if more people start to highlight the impact that it really has, including the business impact and also the value that it has to us as human beings, then I think anyone who has a little bit of interest in it will feel safer to put more interest towards it.
Mm. So what about the diversity and equality that's in reference to the healthcare system? How you spoke about it earlier,
Yeah.
about leadership positions. I do see a lot more Black doctors and Black nurses, and it may be just here in Georgia, that I'm seeing the diversity that's happening in the hospitals and stuff. But and you can't speak for the whole country, but but can you? Is it changing for the most part, or is it, like you said, it's just certain states that believe in the diversity, or is it on the hospitals?
So it's changing, but it's changing in different directions. And I think, just speaking statistically, because I did review this a little while back on the Bureau of Labor Statistics for different professions.
Mm-hmm.
So like I mentioned, the CNAs, the clinical support staff, we've got an overrepresentation of Black women there. The executives, we've got a mix of white men and white women, taking up the majority of that space. And then the doctors, the credentialed physicians, we're seeing some Asian people and some women, getting more presence in that field, but we still have an underrepresentation of Black physicians.
Yeah.
And in health tech, what we'll see is East Asian and South Asian health IT professionals, as well as
Mhm.
other races too. But when I highlight these, what I'm highlighting is who is overrepresented.
Yeah.
Who is being represented at a higher density than the actual population. So it's definitely, there are these different concentrations, and that's really a function of supply and demand, who's coming out of the schools with the education. And
Right.
so there is a gradual flow of change that we're seeing happen. But I think the danger is, when organizations treat DEI as a checkbox and they say, well, we have people of color, and they're not asking, well, where are those people of color employed? What roles are they in? How are
Yeah.
they in relationship to serving and receiving services? And who are the more credentialed ones? Who are the ones that are making the money? And who are the ones that are making less money than they should and doing more work? When
Mm.
it takes more effort to dig into those questions rather than, oh yeah, we employ enough women, we employ enough people of color, we're fine. But
Yeah.
really, what specifically is going on and why? I want to see more of that question being asked.
Right. Yeah. So why is the healthcare system so hard to change? And are you hopeful that it can?
Well, first, I'm really hopeful in the sense that things look hard to change when you look at it from the perspective of we need to fix all of the problems right now.
Yeah. Yeah.
We're not going to fix even 1% of all the problems in our lifetimes. And that's a reality that we have to live with, because it's not just about the healthcare system, it's about all of us every day in society. It's about everything. We all want change, we want to see it, and at the same time, it takes time. And by holding that measuring stick of having to solve all the problems, of course we're going to see, oh wow, it's so hard, it's not happening, this is so frustrating. But on a one-to-one human level, so relationships between individual people, communities getting built,
Yeah.
new ideas getting formulated and developed, there is so much change to see around us every day. So that's what gives me hope, and that's what makes me want to contribute more. And I think I'm already witnessing that when I in my own life show up with more humanity and more determination and more alignment with my values and more love and compassion, then I get the opportunity to connect with more people that feel the same way. And maybe the change can happen faster than we expect.
Yeah. Yeah. So with that in mind, what is your vision? What would you like to see in your lifetime for the healthcare system?
I'd like to see more integration with other industries, integration with different communities, integration with the community work that is going on in the different cultural communities, more engagement from people and leaders that are stepping up and saying, I want to live a different way.
Mm,
And I'm going to challenge the things that we've come to accept as normal.
yeah.
And I'm going to take the time with that and really put that effort in, not only mentally, not only physically, but emotionally too.
Yeah. I think when they see the value, the change makers, the ones that have the power to make those changes happen almost overnight. I think once they see the value of a healed world, a healed nation, because we often have conversations, or I've had conversations with people about what I mentioned earlier, that the industry is a business, and having everyone healed may be a loss of income for the industry. But if they could see that that's not the case, that how they can still continue to thrive economically with people being cured and healed, and seeing that value will open up their hearts and minds, and to see from a business perspective how emerging these things and how these changes can make a positive impact on society as a whole.
I agree completely.
How can people get in contact with you?
I'm on Facebook, Kian Xie Official, LinkedIn, and healingthesystem.com is my resource for holistic practitioners who want to interact with the mainstream leaders.
I absolutely love it. Thank you so much for everything that you're doing. This is necessary work. I'm glad that, not saying that you should have went through your experience, but your your experience helped you see a brokenness that needed to change, and how you saw yourself being a change agent. So I want to commend you for that, and also thank you for everything that you've done this far and everything that you will do to help not just change the system, but by changing the system, how the impact that it will have on the world. So thank you so much for everything that you're doing.
Glad to be here, and thank you so much for providing the space.
And to our listeners, thank you for taking time out of your day to tune in. I hope that you were able to get something from this conversation, but also check out all the other episodes. And I hope you're able to get something from each and every one of them. Please feel free to share this with anyone you feel needs to hear it. You owe it to yourself to heal and grow on purpose. Until next time, be blessed.
Thank you for tuning in to Let's Talk About Healing with Yvonne Pierre on Hindsight Media Radio 103.5 FM. We hope you enjoyed the show. Be sure to subscribe, like, and share.